Dr. Bradshaw here, Chirocynergy. We're strengthening our arms today. Okay, today is going to be tricep strengthening. So that's the muscle that runs from the shoulder down the back of the arm to the elbow. Okay, helps you do this motion, straightening the elbow. So we're going to use resistance bands today. You do not need to use that if you are rehabbing an elbow injury or a shoulder injury or after a shoulder surgery. You should take it easy and possibly not do resistance bands at all, and possibly just do this motion without any resistance at all, just doing it in the air, okay? But in this case, I'm gonna show you how to do it with bands. You can also do it with a can of food at home too, if you want. But in this case, I'm gonna show you how to use bands. Resistance bands, handles on each end, works best. And then we're gonna use a door frame to do this, okay? Here's how it's gonna work. You're gonna take the band, the midpoint of the band, you're gonna wrap it around the underside of your door, and then you're gonna close the door on your bands, okay? And just so you can see that at home, you've anchored it underneath the door and just close the door, okay? And then you're gonna get a chair or a stool. That's a little better. A chair or a stool at home, and you're going to position yourself right in front of those bands, okay? And you're going to reach back and grab those bands. So I'm grabbing it like this, but I'm going to put my arms behind my head so my elbows are bent, brought in tight like this, okay? They're not going to splay out. That's how you hurt your shoulder. You're going to split in the elbow. You're going to turn the elbows in, and you're just going to straighten the arms up towards the ceiling and down, up and down. From the side, it looks like this. Keeping those elbows in tight, you're just extending up towards the ceiling and down. I'll show you with one arm here for a second so you can see the position of the elbow is important. You don't want to bring the elbow forward and up. You want to keep the elbow right here as you go up. Make sense? The elbow should stay right here. That's for both of them. Elbow right here, pointing up towards the ceiling, not splayed out, going straight up and down. Straight up and down. And you can do those one-armed if you want to, but when you're starting out, especially after an injury, you want to take it easy. And you can use a can of beans at home, you know, a 12 ounce or 24 ounce for a pound or two. To do that motion, you can just do one arm at a time, or you can do both at the same time, okay? But when you're doing these, you can do 15 repetitions. And you're going to take a break. 15 repetitions again. Break, maybe for a minute. And 15 repetitions again. That's one cycle. You're going to do a couple of cycles a day of this. So do some point in the middle of the day, or earlier in the day, and some point later in the day. Okay? And you will feel this muscle getting stronger, which helps with elbow and shoulder stability. All right.